Can marijuana worsen PTSD symptoms? Have you ever wondered if using marijuana can make symptoms of post-traumatic stress disorder worse? This is a question many people ask, especially those dealing with trauma. Post-traumatic stress disorder, often referred to as PTSD, is a mental health condition that arises after experiencing or witnessing traumatic events. Symptoms can include intrusive memories, heightened anxiety, mood swings, and challenges in coping with stress. Some individuals with PTSD turn to marijuana, particularly the psychoactive component known as tetrahydrocannabinol, in hopes of finding relief from anxiety and insomnia. While this might seem like a reasonable approach, research suggests that marijuana use can actually worsen PTSD symptoms over time. Marijuana impacts the brain by changing how we perceive things, our mood, and our ability to think clearly. Although some users report feeling temporary relief from anxiety or intrusive thoughts, there are also negative effects that can make PTSD symptoms worse. These can include heightened sensory perception, mood changes that may lead to increased depression, and difficulties with memory and concentration. The stronger strains of marijuana available today can amplify these effects, sometimes resulting in paranoia or increased anxiety. For those with PTSD, frequent marijuana use is linked to several concerning outcomes. It can lead to more severe PTSD symptoms, particularly intrusive memories and emotional distress. There is also a greater chance of developing other mental health disorders, such as major depression or generalized anxiety disorder. Additionally, individuals may experience cognitive impairments that affect their memory and decision-making abilities. Moreover, using marijuana can lead to cannabis use disorder, which complicates recovery from PTSD. This addiction can create a cycle where the individual relies on marijuana to cope, but it ultimately makes their mental health worse. Research involving veterans and others with PTSD shows that regular cannabis use does not help improve symptoms. Instead, it is associated with increased severity of symptoms and poorer overall mental health. The relationship between PTSD and substance abuse is also significant. Many individuals with PTSD may try to self-medicate their distressing symptoms with substances like marijuana. While it may provide temporary relief, this can lead to addiction, making it even harder to quit. This cycle can perpetuate PTSD symptoms and increase the risk of further trauma. When considering treatment, it is essential to address both PTSD and marijuana used together for better outcomes. There are effective alternatives to marijuana for managing PTSD symptoms. Evidence-based therapies, such as cognitive behavioral therapy and prolonged exposure therapy, have shown success. Medications approved for PTSD can also be beneficial. Monitoring individuals with PTSD to help them avoid or reduce marijuana use can prevent worsening symptoms and lower the risk of developing cannabis use disorder. In summary, while some may seek marijuana for relief, the potential for harm and addiction makes it a risky choice for managing PTSD. Effective treatment should focus on integrated care that addresses both PTSD and substance use issues.